Hi everyone, Dr. Remy from Pain Free and Fit. Today a great video for those of you with low back spondylolisthesis. We're going to be talking about basic reflexive low back stability exercise and how to put that in your routine to help prevent back pain. Hope you enjoy. So you may ask yourself, what is reflexive stability training for the lower back and why is it important to protect my spondylolisthesis? Well, stability training, remember, is putting your body in its neutral spine position, its safest position based on a body analysis. You know, everyone's neutral spine or safe position from their back is unique because some of us have a tendency to raise one hip up. We've developed the muscles that do that more than the other side, or lean or twist our torso to one side. Some of us have a weak multifidus at L3 on the right or a weak multifidus at L5 on the left. Some of us have a tendency to rotate our pelvis when we move the wrong way. So you know all this through a body analysis, either done with a professional rehab expert that analyzes you, or you can do it yourself. For instance, through the painfreeandfit.com's website, there's a free body analysis that shows you the basics. Now, that won't take you through the advanced small techniques and really fine-tooth comb analysis that a professional like myself will do, but it'll give you a good understanding of where to start to put together a neutral spine. Plus, any of our programs available at painfreeandfit.com for healing exercises have a body analysis. So that's a great way to learn on your own how to self-analyze yourself. With that being said, once we go through basic exercises to strengthen our muscles, to hold ourselves in a neutral spine, we still don't have what's known as a reflexive state of spinal stability. Now, what a reflexive state is something that happens automatically, where you're going to train your nervous system to put yourself in a neutral spine regardless of whether you're thinking about it or not. It's one thing to develop your abs, let's say, to prevent spinal extension, or your extensors to prevent spinal flexion, or the right side of your ab and back muscles to prevent left lateral flexion. When you're thinking of it, when you go to consciously think, I have to set my spine in a protected position when I lift, when I'm at the gym and I'm pulling or I'm squatting. But many times injury happens when we're not thinking about it, when we're just naturally moving and our mind is on something else. This can happen during the day in our daily activities at work. We go to bend something up, we go to twist and pull something, or even at the gym when we're not thinking. We're listening to music, we're thinking about our workout, we're thinking about eking out that last rep or two in a tough set. And our minds are not focused on our stability. And many times that's exactly when the spine comes out of its neutral position, where it moves too far, where soft tissues are pulled or compressed or sheared, and injury happens. So reflexive training begins with using an unbalanced state with a lot of conscious thought to train the nervous system to start holding ourselves in a neutral position, in a safe position. So although they are tailored specifically for the individual, we're going to show a generalized one for you to get the idea today using the typical problem with spondylolisthesis, which is excess extension is causing pain. So let's say you've determined that in your analysis, when you have your tailbone raised up or your pelvis drops into an anterior pelvic tilt, pubic bone down and tailbone up, and it increases the arch of your back, by increasing the bottom of your spine in extension, you have pain. So that's something you're going to prevent. And we'll take another case scenario where torso extension or leaning backwards from the shoulders or the upper spine puts an excessive amount of extension and that causes pain. Remember, extension isn't simply just extension for most cases of spondylolisthesis. The pain is driven primarily either with upper extension, where the upper body is bending back, or the curve is increased from the pelvis bending up. So we'll address both scenarios. Anyway, what you're going to do is you're going to take an unstable surface. Now, in this case, I'm using a soft Airex pad. It's a foam pad that's a little wobbly. You could use 2 couch cushions at home if you want. You could use a bunch of towels laid on top of each other. They're soft, big bath or beach towels. So when you're standing, you have a slightly unstable base. There's a little give to it. It makes your body a little wobbly. And you're going to take a resistance band and affix it behind you. So for this purpose, we're training the avoidance of extension. So we'll take a loop or resistance band, and from the beginning, we'll just put it around our mid or upper torso. Now again, you don't need a lot of resistance for reflexive training. It's just trying to pull you off and make that instability or wobbleness a little bit more. So from the beginning, you can stand with a wider stance. That'll be a little more stable to get the hang of it. In any stability training, you don't want to be moving more than an inch, maybe a quarter inch to start with, and as you get really good at holding your stability, you can explore a little further into maybe an inch in terms of perturbation, the amount of sway or unsteadiness you have. The idea here is to set yourself in your neutral spine first. So in my case, I'm going to hold a little bit of tail under in our first example, because remember, in this example, tail up aggravated spondylolisthesis pain. So I'm going to get that neutral range of motion. I'm going to go tail up till I feel a little pain. I'm going to go tail under, posterior pelvic tilting until I feel maybe a little pull, and then I'm going to put that tailbone or that pelvic roll tilt position right in the middle between those two. So that's my neutral spine. It's the furthest from how much tail up aggravates pain and how much tail under I feel maybe a little pull or a little stretch in the back. So I'm going to set that position, and I'm also going to be conscious of engaging my left L5 multifidus. That's another video we talk about that. So my neutral spine is set. I'm going to be avoiding, let's say, keeping my left hip up and my left rib cage leaning down, because that's also part of my RPI or neutral spine setup. So with all those things in mind, consciously, I get the band and I stand and I start bringing my feet towards each other till I feel a little bit of a pull from the band. Now what the band is doing is it's trying to pull my torso back. So in this first example, let's talk about those people that are aggravated with having the torso back. So I'm going to set my torso also so that I have a little bit of flexion, meaning leaning forward. Too much flexion, I might feel a pull in the back. Too much leaning back with my torso, I feel low back pain, so I'm going to set it right in the middle. So I've got that whole neutral spine set. Tailbone, torso, hip, multifidus. Now let's go through the two scenarios. So the first scenario with the band around my chest is trying to pull my torso back. It's trying to cause my pain. So I'm resisting that. I'll feel my abdominal muscle, and I will bring my feet together until I feel just a little bit of sway. And I'm thinking the whole time as I'm allowing my body to sway left and right, again, maybe a quarter of an inch, no more than an inch, I'm thinking about keeping that torso straight and not allowing it. We're going to keep it in that neutral position and disallow extension. And if I don't feel so much unsteadiness, I could put the feet closer and closer together. And if I still don't feel steadiness, or you're making gains in your training, you can close your eyes. And now my body is going to wobble a little more. And here the whole time I'm consciously thinking, keep the torso forward. I'm resisting the band. I'm using my abs to keep my chest forward, resisting that band pulling me back into pain. Now I can add to this, as I said, if I have a tendency to lean, let's say, to the left with my torso that causes pain, I can add to this a little turn with my body so that the band wants to lean me to the left. So now I'm at a slight angle, and I have two vectors of force I'm working against. One, the band wants to pull me back, and it wants to lean me to the left. So I'm resisting both of those. I'm customizing this reflexive stability training. And again, my eyes are closed. Now you could do that for 30 seconds at a time, up to a minute at a time, several minutes at a time, and reflexive training can be done every day. It's not training to the point of fatigue, so you don't need days off or rest days in between. Now, let's take the other case scenario where the tailbone up, the anterior pelvic tilt, was aggravating pain. Here I'm going to move the band down, and I'm going to bring it below the buttock level, okay? And here, when it's underneath my hips, the band is going to want to pull my pelvis back and cause my tailbone to go up. So now by the position of the band, I've changed the intent of the band. And again, when I go back to feet together and I feel a little wobbly, I'm working on keeping tailbone under. Tailbone under now is holding me in that neutral position that I've determined. And when I get really good at it, I can close my eyes. I can put my feet together. If I get really good, I, even without eyes closed, could hold on to something for a little tap and raise one leg up. With one foot up now, the balance is much greater. And again, my whole conscious focus is tail under and holding my RPI or neutral spine position. I could do both legs, and ultimately I could do one leg with the eyes closed. Again, you'd want to progress this only if you feel that you're absolutely stable and there's no challenge with one of the lesser degrees of instability. So working on this over time is going to develop a nervous system that you're going to actually use less and less conscious thought, because after a while, when you get good at stability training, you'll be able to start deleting your thought and using more of a reflexive where your body's just holding. Interestingly, once you get done with even a few of the basic exercises, such as this one, the first few times, you'll get off that stability pad and you'll notice that your body is still in a little bit of that hold mode, where your abs have still a little tension, so that tail is not going under and the torso is not going back. That's a great warm-up exercise at the gym also you can use this for, because now as I start to use my normal movements, bending, reaching, you can feel it. You try it yourself. You'll feel your abs protecting you from reaching upwards. I'm going to reach up for the lat machine. I'm going to bend and twist to get a weight. Already my muscles have been engaged in such a way reflexively that the nervous system is working harder than ever before to prevent those motions from happening. If you've enjoyed this video on self-help spondylolisthesis exercises, feel free to subscribe to our channel. We've got a lot of great videos out that help you. Questions or comments, write in. As always, I'll do my best to answer. And remember, if you're looking for a great way to learn how to analyze your low back mechanics, how to construct exercises, and even a whole self-rehab routine to help heal and prevent spondylolisthesis pain, check out our Fast Track program for spondylolisthesis, available at painfreeandfit.com. It'll walk you through all the various steps you need to figure out what your posture, movement, muscle imbalance, and low back stability issues are, and successive exercises to build up a good routine to help prevent the pain and assist your body in healing. And as always, if you're having trouble with your analysis or implementing exercises, I'm always available through Zoom for online consultations. I hope this video on spondylolisthesis and self-help exercise helps you with your chronic low back pain.